everyone. Welcome to the It Hurts to Mom podcast. I'm Lauren Rose, and today we're talking about managing chronic pain through hypnosis. Our guest is Melissa Boher Jacobson. Melissa is a highly trained certified clinical hypnotherapist, rapid transformational therapist, a certified medical hypnotherapy practitioner, and certified smoking vaping cessation specialist. Over the last 23 years, Melissa has empowered thousands of individuals of all ages to overcome anxiety, fear, unwanted habits, and issues. Thank you for being here.
Thank you for having me today.
This is a new topic for me, so it's one I have not covered on this podcast before, so I think it's going to be really interesting.
Yes, I think you will find it very, very interesting. And we started talking before the recording a little bit about how powerful hypnosis is. One of the most powerful ways to manage chronic pain. And it's a wonderful way because it puts people in control. And I think
Mm,
that's very, very important because when you're in chronic pain, you feel like your body is working against you. And that's something I would love to talk about a little bit as well.
well, let's just start by talking about like what exactly hypnosis is, because I know we've seen like stage hypnosis where people start acting like chickens and silly things
Yeah,
like that. So, can you give us some more information about what it really is?
right. That's a really good way to start because a lot of people have a lot of misinformation about what hypnosis is, and a lot of that misinformation does come from their experience with entertainment stage hypnosis, which is really fun and really interesting. Um, but that's not what hypnotherapy uses some of the same techniques, but we use it to elicit change, permanent, rapid, permanent change for our clients. And hypnosis is something that's very, very natural. We are, it's also known as a trance state. And I used to not like that word very much because it made me think of, people walking, sleepwalking or zombie like. But really, we are in a state of trance all day long in different ways. So hypnosis is a very, very natural state. Um, when people are in pain, they are in a trance state. They're focused on the pain. That's one example of we're already in a trance state or under hypnosis in a way. Another example of how hypnosis is a very normal state that we're in is when we're watching a film or a movie or reading a book or um, one of my favorite descriptions, I call it carnosis, when we're driving somewhere, right? And we are like, I need to go to the bank. Why am I at the grocery store? Because this happens to me a little too often when I'm thinking about a client as I'm driving to my office. And yeah, the whole world just goes away while you're in this very altered state of hyper focus, is really what it is. Daydreaming is another kind of trance state. So this is something that's very normal, and people say sometimes, oh, I can't be hypnotized. And I'm like, well, actually, you already have been a lot just today. There's a very normal state that we're in. As a matter of fact, I ran into my neighbor today, and his wife is a smoker, and he desperately wants her to quit smoking. And he said, well, she thinks she can't be hypnotized. And I said, well, actually, she's already hypnotized. She's hypnotized by her belief that she gets some kind of benefit from cigarettes. So, you know, it's a very natural state. As a hypnotherapist, we kind of we uh, we use that state. We guide people into a deeper version of that. We kind of harness the power of that state that people naturally uh, do every day, and we take it to a deeper level because hypnosis is a way to maximize the opportunity for change, and it's a way to access the most powerful part of the data that we call our mind.
Mm. You definitely make it sound a lot less scary than I think I had maybe originally been thinking about it as. So I
Mm-hmm.
definitely appreciate that. It does sound more more natural, like you were saying.
Yeah, most of my clients will tell you that it's the most relaxing, it's very pleasant and relaxing and empowering feeling. And hypnosis, as I said, it's something that we do all day long. But when you're, quote, and I don't like this word very much either, this under, because it makes people assume that they're under a spell or
Hmm.
something like that, and you're not. In hypnotherapy work and change work, the client is absolutely in control, and that's very important. And I do work with a lot with people with anxiety, and that's very, very important, especially for people that experience anxiety, that they feel in control. That's one of the most important things. Clients are absolutely in control. They can stop, start. They can, they can do. We're really just the guide. We're guiding them to the solutions, as the voice that's guiding them there and making suggestions that really come from the client. So it's there's no this business of being this expectation of people being under or
Hmm.
under the spell of a hypnotherapist. It does look that way in stage hypnosis, but that's not the experience at all when you work with a hypnotherapist. It
Okay, and
really
I
shouldn't
like
be.
that. Yeah, I like the fact that you say that, the client is in control because that's the one thing I hate the most about anxiety and chronic pain is I don't feel like I'm in control of my body or of my mind. So I think that's a really crucial aspect of getting any kind of help for those things is feeling like you're in control. So I really appreciate that.
Yes. And one of the things that I'd like to talk about today to make sure that your listeners have something that they can use right away is to talk about the relationship and the science behind relaxation and pain. So, pain, um, pain is it's a function of our nervous system, and it's useful to think of our nervous system sort of like the wiring in a house. Um, and the pain receptors, the nerve endings, communicate. They send signals across to each other. And so we'll find that when we can get into a state of relaxation, and hypnosis is one of the deepest forms of relaxation, that the pain receptors, the nerve endings themselves, under relaxation, actually move further away from each other. And so those pain signals that are being sent back and forth between those endings, they have further to go when you're more relaxed. And so immediately people will find that when they're more relaxed, that that's going to give them some relief right there. But a lot of times when people are feel that they're in chronic pain, they feel that out of control, that does create anxiety, and that anxiousness will exacerbate the pain because it'll, for a couple of reasons. It makes us more tense. So our muscles are going to be more tense, so that's going to cause more pain. But also just this aspect of the signals being able to move really quickly when we're tense and when we're stressed and anxious. The pain is communicated. Those endings are right next to each other, and it's really easy for them to send those signals. So that's going to make a huge difference. So that's just a takeaway. If we can find ways to uh, relax, and again, hypnosis being one of the most effective ways to create relaxation, that can really, really be beneficial for most
So
people.
So it sounds like, because I guess I've always thought of hypnosis as being pretty woo-woo, right? But it sounds like it's actually based a lot in science. So how does the scientific community view, as a whole, view hypnosis? Are they in on it? Do they like it?
Oh, yes. As a matter of fact, most people don't realize that modern hypnotherapy, the sort of grandfather, the founder, unofficial, I would say, the person who really started to use hypnosis therapeutically was a man named Milton Erickson, who was an American psychiatrist, psychologist, and therapist. And he's the one that's really started using, I mean, it was used before him, but he's the one that really developed it in a way that it is used by, I'm a hypnotherapist and a life coach, but there are many people who are psychologists, psychiatrists, therapists who also use hypnosis as part of their toolbox. And science loves hypnosis. And if you go on my website at melissaboherjacobson.com, there's a whole page that's devoted to just some of the many, many studies on, and particularly around pain, how hypnosis is used instead of, hypnosis is used in childbirth. Hypnobirthing is one of the most, I mean, childbirth is a very painful
Yeah.
experience, and it's used very effectively in that setting. It's also used a lot in situations where people cannot have anesthesia.
Mm.
So hypnosis is a very, very powerful way that science and doctors and dentists use it all the time. As a matter of fact, there's a lot of studies about using, and I've used this myself, pre-surgery and post-surgery to help people relax. It makes their blood pressure go down, and surgeons really like it because when people are more relaxed, the surgery goes better. Their blood pressure's down. Some people can't even start surgery because their blood pressure's too high. So we can use hypnosis to get people ready for surgery. There's studies about how it's helped people heal better after surgery. There's even a lot of information about how even burns, hypnosis can help people heal more rapidly from burns. There's a very famous professor of psychology who talks about how um, anything that causes inflammation, histamines and inflammation in the body, can be helped with hypnosis. There's a lot of very impressive studies about breast cancer patients, um, how hypnosis has helped them with pain, with healing. There's a lot of studies about diabetes because hypnosis really helps minimize stress. And stress, chronic stress, causes inflammation. And so
Mm.
a lot of people who are suffering from chronic pain, it's caused by inflammation. So it's like a vicious cycle. When I'm very have a lot, if I have an inflammatory um, disease of some kind, and I'm stressed about this pain, it's like it causes more inflammation, which causes more pain. So hypnosis can
Mhm.
really be amazing. It can bring people's A1C down because
Wow.
when it comes to diabetes, because when people are stressed, it causes cortisol production, which has an effect on your blood sugar. So yes, it, it's for some of my colleagues. There's a combination. I'm more of a data based person. My background is in school psychology, which I have a very mixed background. I come from the performing arts world, but I also studied to be a school psychologist. So um, I'm very data driven. I want to personally, I want to see the data. I want to trust, and I think that's really important. There's also a lot of aspects of hypnosis that borrow or combine with some of the Eastern um, energy work and medicine, and those things can be very, very, very powerful too.
So I'm
So
pretty
it's good to have a balance.
Yeah, I agree. I think that Western and Eastern, when you put them together and do some kind of, modalities, I think it can be very powerful. So I don't dismiss anything that they do in the Eastern world because it's been around for thousands of years.
Exactly. That's exactly why. That's exactly the case.
So I'm sure that you've got some good stories of people who have been improved. from chronic pain through hypnosis.
Yes, I have some great stories, but I think it might be, I know that there's something you've talked about on your podcast before,
Mhm.
but I do want to talk a little bit about the fact, and I will get into two stories, one recent and one less recent, maybe from about 6 months ago. Um, I want to talk about how pain is important. It's the way that the body communicates to the brain that something is wrong. And
Mhm.
it's very important that we understand that pain serves a purpose and that there are two kinds of pain, both of which can be helped with hypnosis. But acute pain is when you break something, or you cut something, and it's important that the body communicates that to the brain so that something can be done about it. But when it comes to chronic pain, there's oftentimes with chronic pain, it can be, like I said, it can be caused by any number of things, but it's typically something that it's not necessarily an ongoing thing, and the brain already knows and has tried to fix the situation. So, um, what's important to understand is that pain is felt in the body, but it's processed in the brain. And there's a there's a system. Our nervous system is very intricate. It's tied in with all of our hormonal function, and it's a very, very complex, finely tuned system whose prime directive is to help us. Your body, I want to make this point really clear, and then I want to get back into the science of how pain is processed and how hypnosis can affect that. But I often say to my clients, because it's easy to forget, that our body's prime directive is to love us and help us.
Mhm.
And even when we are suffering with pain and inflammation, it's our body is sending inflammation to us because it loves us. Every cell of our body, its prime directive is to protect and help us. And when we start to hold it that way, it shifts things a little bit, just right there. We say, I have uh, inflammation in my body because my body's trying to help me heal, because my body loves me. And it's true that we inflict a lot of damage on our own bodies without even trying. We could eat really well, and we don't eat foods that we're allergic to, and we exercise and we do all the things, but we're still ingesting toxins, you know, no matter where we live. So our cells are kind of being hammered all the time, and no matter what we do to our cells, they're constantly trying to heal us. And that's what inflammation is, body trying to help us. So I do want to point that out, that our bodies, every cell of our body is engaged in unconditional love. It might not feel
Mhm.
that way all the time. It might not seem that way, but it is. And it's, I think, an important concept and an important way to frame our bodies as being loving towards us and trying to help us. And we really, every cell of our body is engaged in unconditional love towards us. So we are brought into this world in love, and our bodies love us unconditionally, even though some of the things that our body does to help us might hurt. It's all out of love.
Mhm.
And I think that that's an important thing to consider. Back to the way pain is processed. So it's really interesting that the body sends a signal to the brain that says, hey, there's a problem here. And the brain processes that information and then sends a protein, a neurotransmitter, back to the area. And that is called, um, it's called substance P. There's a longer name for it, but it's a neurotransmitter that then the body, this all obviously happens instantaneously, But this is why hypnosis is powerful in chronic pain relief, because it can interrupt that signal. It can change it.
Mm.
And one of the interesting ways that hypnosis can do that is it can change the experience of pain from a kinesthetic experience that is like a feeling experience. Through our brain, we can shift where we experience the pain to a visual experience or an auditory experience. And the brain processes that differently than through feeling. So that's a powerful way that we can use what's called submodalities, which is a way the body sort of, your senses basically, how the body experiences life. And when we shift into a different submodality or a different sense, we can experience pain differently or not at all. So that's one of the powerful ways that we can use hypnosis. And there's lots and lots of other methods. One of the and we'll talk a little bit more about some of those methods. There's many of them, but to talk about a story from about a week and a half ago, I have a client that I've been working with for some time. I'd never worked with her on chronic pain because I deal with many other issues, insomnia and anxiety and self-esteem and business success. And these are all things that I've been working with this client on. I'd not addressed chronic pain. So I went actually to see her, and she had chronic pain in her neck as a result of bulging disc and, different reasons why, but we got that pain from a 10 down to a 0 using hypnosis. She also had a squeezing that was going on in her diaphragm area, and we got that down to a 0 too, using various forms of hypnosis techniques. And I'll talk about some of the ones that I used. Another young lady was experiencing chronic pain in her wrists. And we used a different method to get to the root cause of her subconscious mind, we realized, was telling her that she needed to experience pain in her wrists because when she was younger, she would draw and write without stopping. So her mind gave her a way to stop her from overdoing it. But it went too far in protecting her, and then it started to have this chronic pain in her wrists all the time. So we eliminated that so that she could have the freedom. We told her mind that it's okay for her to draw and write, that she knows when to stop now. She's no longer a teenager who doesn't have impulse control and doesn't know when to stop. So that was a great success story to give her the freedom. Her mind agreed that it was in her best interest to write and draw because that's how she loves to express herself, and that pain was no longer part of her experience either. So that's a couple of different approaches. Sometimes the mind will come up with a system to protect you because it thinks it's in your best interest to keep you from doing something. So again, it depends on the situation. It depends on the person.
I think it's so just amazing how powerful our minds are.
Yes. Well, I'm going to tell you a little bit about the concept of our minds. So the brain is the organ, but interestingly, the brain, what makes up the brain, it's a collection of, I don't know, trillions of neurons, brain cells. I really don't like to call them brain cells anymore because we find that those neurons are in our heart muscle, in our heart area, and also we found that there are billions of them in the gut lining and God knows where else we're going to discover that that same kind of material is located, and it makes a lot of sense. So we have intelligence throughout our body. We now know that scientifically. And we're discovering more and more about that. But this organ or this collection of neurons stores data. And if I like to use the analogy of a computer because most people can relate to that. When we have like a C drive that stores the files that we create, and then we have we'll call it an S drive instead of a D drive. The S drive is the operating system, the big tower that stores all of the operating systems that help us create those files in the C drive. So the C drive is our conscious mind. Um, the stuff that we're aware of as we go through our day. The S drive is the subconscious mind that stores every experience that we've ever had. It stores all our patterns, all of our habits, all of our emotions, and all the operating systems for this very complex system that we call the human body. That's where those operating systems are stored. And that's where we go in hypnosis, to that side. And that's the most powerful part of that data that is stored in those cells of the brain. And as a matter of fact, that's the part that we're least aware of, but that's the most powerful part. And as a matter of fact, the conscious part, where the files are, our personality and how we process information and we make decisions and we solve problems, that's all on a conscious level. That side downloads about 40 bits of information per second, our waking state. The subconscious mind downloads 40 million bits per second. So that's kind of mind-blowing, isn't it? So
Yeah.
it's obvious which part is more powerful. The operating system that we're the least aware of is the part that's really running the show.
Wow.
So in hypnosis, we access that part. And that part, and by the way, I always talk to my clients about sleep, because sleep is also very, very, very important for all people, because the subconscious mind is in charge during sleep, particularly during rapid eye movement sleep, which is when we have dreams. And what dreams are is the subconscious mind processing the events from the day before, filing and storing and processing through the emotions. Mm. And while that's happening, the body is also detoxifying itself. So when people are not getting enough sleep, maybe because they're experiencing chronic pain, again, we have a vicious cycle going on. And the chronic pain is going to get worse. The inflammation is going to get worse because the body isn't able to detoxify itself, nor is the mind able to properly process through emotions. And those emotions can cause, they get stored in the body and can cause additional pain as well. So sleep is a very, very crucial aspect of dealing with health in general and chronic pain in particular.
I know a lot of people with chronic pain don't get enough sleep, myself included, because I wake up and I'm hurting. So I have to go lay on the couch to get some kind of support on my back, or I have to move around a lot because my hips hurt when I lie on my side. So it's definitely been a problem for me that I'm trying to work out with my doctor.
Yes. And so I want to tell another story, if I may. I have a million of them. But just recently, sleep is so crucial. I've been working with a young man. I've been working with his family for several years, and the middle child has autism spectrum disorder, and he's high functioning, but a lot of people with ASD lately, I've been hearing, because they really like computers, they have been, staying up too late, waking up in the middle of the night and getting on their computer. And then this is causing emotional breakdown and anger issues and personality changes, and even some almost psychotic behavior to occur. And so this young man's family was getting really worried because they're starting to see some of these things happening. And also, it was so disruptive and destructive to the rest of the family, because they live in a small home and there's five of them, and nobody was getting sleep.
Mm.
So it was causing tremendous, almost to the point of violence in the home. This one person. So anyway, this past week, every night, I was calling him at 10:30 at night and putting him to sleep hypnotically and transforming the entire family's life. And last night, he used a recording and he went right to sleep. And like, life has gotten so much better. And the reason I bring this up is because that child was in danger of being put on more medication. In fact, the psychiatrist and I were working together to determine if we could avoid that. We're experimenting to see if hypnosis could be done instead of more medication. And it was a tremendous success and changed this family's life. Not just his life, but their entire life in the process. So, hypnosis, and so powerful for chronic pain and insomnia, and those two things being tied together. It's powerful for so many things in addition to pain and insomnia. It's really an amazing modality that I'm very, very, very passionate and proud to be able to deliver to people, because it's change work that really changes people's lives. And that's what they want.
Yeah.
They want change, right? We're here to, let's find a way, searching for ways to have life be better. And it's a really powerful way to make that happen.
So you've completely convinced me that, hypnotherapy is very scientific and not just out there and woo-woo. And you just talked about how a person could be hypnotized by a professional like you over the phone. So could that be done virtually as well, like via video?
Yes, absolutely. In fact, I do see people in person quite frequently, but I see lots and lots of people via several different platforms. Yes, it can be done over the phone. In fact, this young man, it was by the phone. I was on the phone. And it was very interesting because somebody had to come and
Yeah.
hang up the phone.
Yeah.
It can be done by Zoom. It can be done by FaceTime, Facebook Messenger. I've used all of these platforms. Skype isn't used so much anymore. It's kind of gone by the wayside. But yeah, absolutely, it can be done on any platform, whether it's the phone. It works just as well remotely. I have tons and tons of clients from all over the world: Germany, UK, Hong Kong, Australia. It's the biggest challenge in all of this is time zones.
Mm.
That's really the only major challenge. There's certain advantages, of course, to coming. Some people do prefer to come in person, but there's certain advantages to doing this work remotely, because sometimes people, especially if there's a lot of emotion that comes up. Like, I had a client that I released from a phobia the other day, and she was very tired, very, very tired after the session. So when that happens, it's really good to be at home in your own bed or your own couch. If you're tired, you don't have to get in your car and drive 40 miles. I I feel a little bit better about that when I see people remotely, if they're, because different people have a different response. Um, so yeah, it's just as effective. There are certain adjustments that we do make, but in terms of the results, absolutely just as effective remotely as in person.
I think that's really interesting because I guess I would have imagined it would be only effective in person. I don't know why. That's just how I've always imagined it. But with so
Mm,
many things going virtually these days, I guess I'm glad for you, in your profession that you can have people do it virtually. Um, can you teach people how to do it themselves, like self
yeah.
hypnosis? Is that a thing?
Yes. Yes. And it's very important when it comes to chronic pain
Mhm.
that we teach the client how to do it on their own because it's not a permanent fix. You come to see me one time. You need to be able to manage that on your own when I'm not with you, right? And
Mhm.
I'm a big believer. My philosophy, one of the reasons that I'm not a traditional therapist is because I want to I do change work that is permanent. And I don't want people to be dependent on coming back to me. I want them to be free, to live their life. Uh, and I'm a confident life coach. So I want people to have control and confidence in their life and to know that they are responsible and that they have this autonomy and this whatever control we have in this life, I want them to feel all of that. So, being dependent on someone else is not a feeling of confidence and control, right? So, it's really important, yes. It's important that we teach people exactly what they can do to have the power and the control on their own.
And I
And
like
then,
that because
go ahead.
well, I think that the job of a therapist is to make the client not need that therapist anymore. So I
Right.
like that you have that philosophy.
Yes. And the cool thing about hypnosis too is the more that you do it, the better you get at it, and the better it works. So when people learn how to do it themselves, they keep doing it, and then they start to feel more and more confident and more in control, and that's huge.
Mm.
You can already, as soon as you start to feel any sense of control, you feel better. You know? So, and I do think that um, to a degree, because pain is processed by the brain, the source or the cause of the pain medically doesn't necessarily matter, right? That being said, I think it is very important to say that it should be under doctor supervision, because we don't want people doing things that are going to hurt them. We want to make sure that they're safe, but we do want to give people, you know, hypnosis is a natural way with no side effects to manage pain. And if it doesn't work, you're not there's no harm, no foul either, right?
Mm.
You're not going to hurt yourself. But you can hurt yourself if you know, pain is important and pain is there for a reason. So you do want to be careful and you want to be mindful um, that you're protecting your body, right?
Yeah, that makes
But if
sense.
you're sitting around and you're having chronic pain, let's help. Let's mitigate that. No. So common sense. Important to have common sense, right? Approach.
Yeah, that's important. I totally agree. And a lot of people, don't have common sense these days, but hopefully when it comes to our bodies, we do, because that's very important.
Yes, it is very important. I feel like the common sense around our bodies is a problem for a lot of people.
Mm.
There's a lot of confusion um, around our physicality, and there's a lot of information too out there. And it can be hard for people it can be, let me put it this way, I think it's easy to get overwhelmed with all the information, and it can be pretty paralyzing in and of itself.
Yeah.
Where do I go? What do I do? Is this going to work? Is this not going to work? So, and I think sometimes people are too quick to try things that are not sourced from within their own body. and they don't often do enough research to find out like what are the side effects. They're really a little too trusting sometimes, a little too ready to jump on the bandwagon to ingest something without really knowing what the downside risks are. So with hypnosis, there's really very little downside risk. It's
Yeah,
just
that's an important note too, that if you try it and it doesn't work, you haven't harmed yourself. So I really like that aspect.
right, right. And it's very powerful.
Yeah.
Very powerful for a lot of things.
So regarding pain management, talk about the roles of like relaxation, distraction, time distortion, and dissociation. What do those mean and how are they helpful?
Right. So we mentioned relaxation before. That when you relax those nerve endings that communicate pain to each other, that those move further apart. So hypnosis is a powerful way to really, really deeply relax. Um, Let me see. I want to make sure I'm not forgetting. There's um, distraction. Distract. Oh, I remembered it in order. How about that? So distraction. So again, we mentioned that hypnosis is a natural state, and when we focus on something, we use the power of the brain and the mind to focus our attention on something else. The mind can forget that
Mm,
it's experiencing pain because a different part of the brain is functioning, and blood is flowing to a different part of the brain that's dealing with whatever we're using as our distraction. There's also a part of the brainstem that's called the reticular activation system that works in our favor. That when we focus our attention on something, all of our brain, that the blood flow goes to that part of the brain, and it focuses our attention on that particular thing that we're telling it to focus on, and it will kind of blot out everything else, including pain. So distraction can be really very, very powerful. Time distortion is when we use suggestion and use the power of the brain to distort how long we're experiencing the pain, to tell the mind that it's shorter than we thought it was. So again, we're using different parts of the brain, different parts of the processing senses of the brain, which, by the way, that's subconscious storage. Those operating systems are stored there. So we're using this concept of time to distort. I'm only feeling that pain for a second, even though it might be an hour. Okay, so that's the concept of time distortion. Just making that suggestion. Time distortion is a very real thing. Um, there's a lot of interesting science going on around that as well. How we process time. Disassociation is very, very interesting. So disassociation is when, for example, I love this example. There's a man named Tad James who created this process of looking in a mirror, looking at yourself in a mirror and asking the person in the mirror, where's their pain, right? So it's a form of disassociating, taking, imagining yourself out of your body. And this is something we can do really easily in hypnosis, where we can actually imagine that we are watching ourselves instead of being inside our body. We're watching our body, and we can start to move that pain around. We can start to take control of it. Pretty exciting stuff. Um, so that's what disassociating is like: removing yourself, watching yourself from outside of your body, or imagining that you are. And then you asked, yeah, those are the things. And then there's a really powerful modality that we use. It's commonly called glove anesthesia. So under hypnosis, we use these submodalities to convince somebody that their hand is is numb from cold, and so anesthesia, when we're numb, right? We numb the sensation using the imagination, using suggestion, because the mind does not know the difference between what's real and what's imagined. So it'll experience things imaginary as if they're real. So one example that is often used is think of sucking on a lemon, and people's mouths will start to water, and they'll start to or smell the scent of the ocean, breathe in the smell, and you'll actually smell that salt air. It's not there, but your brain will process it as if it was. And so this love anesthesia is a very powerful way to numb an area, and then we can move that numbness all around the body. And so we can give the client the sense that if they can move that pain around the body, what does that mean? That means they're in control,
Right.
right? So those are some of the many ways that we can use. There's also when we really, really overanalyze a pain, really like break it down. This is something that worked for my client around the neck pain. We kept looking at it and examining it and over examining it, and it just went away. It just collapsed because we were just getting so detailed about what it was and where it was, and eventually it just disappeared. So
Wow.
that's something that can work really well too.
That's really interesting. I find this fascinating personally. Is there anything else that you want to make sure you let everybody know about hypnosis before I ask you about like your one piece of advice that you have for people?
Again, I mean, hypnosis um, is something natural. It's very relaxing. It's a very powerful, positive, wonderful state, and it's very potent. A great way to elicit change. And I personally have lots of stories. You can go to my website and see some of the ways that I've helped people, and that's just a small sampling because I'm lazy about uploading to my website. Um, but I highly recommend it. I think it's important to work with somebody that is good at it. A lot of my clients have come to me and they've said, well, I tried this before and it wasn't great. So it's important, I think, to work with an experienced practitioner, somebody who has a high success rate, that's been, has some serious experience, serious training. It's important that the person that you're working with really. I always have a one-on-one. I always have a consult with a client. I won't book somebody for a session unless I've spoken to them first. I think it's important to have an alignment with the person that you're working with. I think it's important to know that the person really has your best interests,
Mm.
that they really care about you getting the most benefit from the work that they're doing. I think it's important to ask questions. Um, so that would be I would say definitely try it. I will say that there are certain limitations. It's also important that a hypnotherapist knows their limitations. They should not be working out of their scope of practice. For example, I personally do not work with people who have bipolar disorder, schizophrenia, OCD. I don't I don't work with people. I do refer out. I have a whole list of people that I trust that I will refer people to because I want people to get better. And if
Mhm.
I can't help them, I want to find somebody that can. But I'm not going to be irresponsible and try to help somebody that's not within my scope. So I think it's very important to make that distinction. Um, Also, it's important to work carefully with people with epilepsy.
Mm.
Um, I can definitely coach people with those. With epilepsy, I can coach people in confidence. I can do life coaching. Strategic life coaching is something that I do a lot of. Um, but I think it's important to make sure that your clinician is not working out of their scope and that they're responsible, because I do see a lot of people just taking on every kind of client, and that's just not, it's not responsible, in my opinion, to do that. There's plenty of therapists who are qualified and trained to work with those issues when it comes to mental health, and it's important to be responsible.
No, I agree. That's really, really good advice. Speaking of advice, what advice do you have for people with chronic pain?
I think, first of all, to reiterate what I said before, that your body loves you. It might seem like that, but to not hold it as being in war with your body.
Mm.
Your body really is doing its best to help you, and I think that that's really important to understand. That might even give some people some relief right away, because it's going to mitigate some stress when you realize my body loves me and I'm going to love it back. Secondly, I think relaxation is very, very important. Relaxing, deep relaxation, as I said, to extend that distance between those pain receptors, those endings, so that those pain signals have much further to go right off the bat. I think people are going to find that that's something that's going to help them. And if you're having trouble finding a way to do that, then hypnotherapy is definitely something to consider. It's a very
Awesome.
deep way to relax.
So remind us where we can find you. I'll have your website in the show notes and any other links that you might have.
Sure. Very easy to find me. You can go to melissaboherjacobson.com. My name is my website.
Perfect.
And I also have a website called stopwithmelissa.com. And if you have clients that are using alcohol or vaping or smoking or overeating or things like that, um, to manage stress or anxiety, uh, we have many ways to replace that with something much better, and to free you from that as well. So, melissaboherjacobson.com, you'll find pretty much everything about me there, including the research. If you go to, you know, I think it's Does It Work is the menu part that you go to, and in lots of testimonials, you can find out. And I invite people to set up a free consult. I always consult with people before I work with them. Um, you can do that at www.meetwithmelissa.me. And you can set up
So
a free 20-minute consult, and we'll discover together if this is something that's right for you. Or if, you know, like I said, um, my passion is change, helping people change. And if I'm not the one to help you, I will certainly refer you. I also wanted to mention something called the Dissolve Anxiety Protocol, which I have, which is a very low cost, kind of entry level course. Um, and it's a $27 course, so it's pretty accessible. And it's all about educating people on anxiety and giving them some strategies to start to take ownership of that as well. And there's it's a great program. There's an insomnia antidote inside that program too, which you basically get for free. So that's some resources
great.
there.
I will have all of that in the show notes. I might check out that Dissolve Anxiety Protocol because I've got a lot of anxiety, so that sounds interesting to me too.
Well, let me know, and feel free to get on a call with me as well. We can talk
Okay.
about that.
All right. Well,
Okay.
thank you for coming on. I appreciate it.
It's my pleasure. Thank you so much. I feel blessed to have been selected to be on your program, and I hope it's been helpful
I hope so
for
too.
your listeners.
Yeah, I really hope so. And definitely go check out her website and look at all the data that she's got, the scientific data, because that's one thing I found really interesting about all this is just that it is very scientifically based. So I like that.
Me too.
All right,
Okay.
make sure to subscribe to this podcast so you don't miss any health, parenting, or life advice. For my freebie, which is 30 ways to relieve pain without taking a pill, go to ithurtstomom.com/tips. If you have comments, suggestions, or want to be on this podcast, email me at ithurtstomom@gmail.com. I wish everybody a blessed and pain-free day.